On this Monday night, rising hospitalizations among younger Canadians. One mother's anxiety over her son's health.
Talk about a scary, terrifying experience.
Plus, Ontario's patchwork of policies on school closures. A secret restaurant in Paris busted. Was the foie gras worth it? And the Vancouver Canucks season on pause.
It's really incumbent upon the Canucks organization and the league to really ensure that the situation is tightened.
Most of the players benched by COVID. The domino effect for the rest of the league.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. We begin tonight in Ontario, where one health region is taking new measures to curb an alarming rise in COVID-19 cases. Starting tomorrow, schools in Peel will close for at least 14 days and move to remote learning. The region's top doctor says this closure is a necessary step to protect staff and students in Peel region. With increasing case counts and the presence of variants of concern, we need to break chains of transmission and keep our schools safe. But Ontario's other hot zone, Toronto, has not ordered schools to close despite growing calls to do so. And today, the chief medical officers for Toronto, Peel and Ottawa issued a joint letter calling on the province to issue stay-at-home orders. In Ontario and across much of the country, a younger demographic is getting sick, really sick. Abigail Bimman talks to the frontline workers who are witnessing it.
It's heart-wrenching. It's heart-wrenching as a mother.
Matthew Cardinal's mom says he was totally healthy before he got the UK variant. After 2 weeks in the ICU, she's thrilled to report her son is off the ventilator, eating solid foods, and now able to move from his bed to a chair. He's 34.
My family, talk about a scary, terrifying experience. I don't wish this upon anybody. I just want people to take any necessary precautions.
It's quite disturbing of a pattern to see, people in their 20s and 30s on life support and breathing tube in their throat, keeping them alive. This is not something that we are used to seeing or we should expect to see in a country like ours.
Cardinal is one of 44 people with COVID-19 in a Saskatchewan ICU. Nearly 30 are in Regina. Further east, Ontario fares the worst, reporting around 3,000 new cases each day for the past 4 days. Currently, nearly 500 people are in an ICU with a COVID-related illness. And over the past 2 weeks, 210 Ontarians hospitalized with the virus were younger than 50.
The hallmark of this variant is that it's much more infectious, and it's much more likely to cause serious illness when someone becomes infected with it.
Dr. Callie Barrett is one of many calling for better protections, including vaccination for essential workers, and points out if younger people survive the ICU, there's often long-standing physical trauma from the medical care required.
The essential workers that are keeping our cities running are unfortunately now dying as a consequence of COVID-19, but also if they're surviving, are being maimed.
As for Matthew Cardinal, his mom can't wait to hug him and wants to see him walk again.
I could see the progress right now, but tomorrow, I have no idea. It's one day at a time right now, and I'm hoping for the best.
Hoping for the best, alongside more families worried about younger loved ones in hospital. Abigail Bimman, Global News, Ottawa.
Quebec's health minister says the hospital situation in that province is concerning, describing the ICU capacity as fragile. So tonight, the province is imposing strict lockdown measures on 5 more regions south of Quebec City. So far, there are no new measures for Montreal. Those highly transmissible variants are a major problem in BC and Alberta. The B117 variant, first discovered in the UK, is growing exponentially in those provinces. And now the P1 variant, which first emerged in Brazil, is surging too. As Heather Yourex-West reports, health officials are warning Canadians, even those who have been vaccinated, about the serious risks.
Hospitals in BC and Alberta are bracing themselves for what could be a devastating spring.
We're now seeing in the hospital and the intensive care units are younger people between their 40s and 50s who are having devastating responses to these new variants.
But it's no longer just one new variant driving exponential growth. Last week, a large cluster involving the P1 variant that first emerged in Brazil was identified in the Vancouver coastal region. Many cases linked to an outbreak in the ski town of Whistler, BC. BC Health ordered the ski resort to close as part of new restrictions to control viral spread.
We're seeing the numbers of these P1 variants grow faster than we are for other variants.
The P1 variant first emerged in Brazil in late December 2020. The first Canadian case was confirmed in Toronto on February 7th. BC didn't report its first case until March 9th, but as of April 1st, there were 379 cases, making BC a global hotspot for this highly infectious variant. Alberta Health is also investigating what it calls a significant outbreak linked to a large employer with multiple sites across Western Canada. So far, 3 cases of the P1 variant have been confirmed, but that number is expected to rise.
The emerging data does suggest that the P1 variant causes more significant, worse disease in younger people, worse outcomes, increased hospitalizations.
There is also evidence the P1 variant virus can spread among those that have received a COVID-19 vaccine, though vaccines should prevent those infected from becoming seriously ill.
There are not a lot of direct studies on vaccine effectiveness in P1. They're lab studies. And based on the lab studies, the vaccines that we have in Canada right now do have still an ability to neutralize the virus in terms of the antibody response.
Alberta's Chief Medical Officer of Health did not speak to the media today. Her next update is scheduled for tomorrow after the Alberta government's COVID Cabinet Committee is scheduled to meet. They will be discussing Alberta's rapidly increasing COVID numbers and whether more restrictions will need to be deployed. Robin?
Heather Yourex-West in Calgary. Thanks, Heather. Despite rampant cases of COVID-19 in much of Europe, the UK is emerging from nearly 4 months in lockdown. Daily infections have been falling steadily since mid-January. So too have deaths. And more than 31 million people have received at least one vaccine dose. But as people look ahead to summer plans, it's unclear if trips abroad will be allowed. As Crystal Goomansingh reports, the government is assuring people they won't need a so-called vaccine passport to enjoy their desperately needed freedom.
Spring is in the air and social lives are about to blossom.
On Monday the 12th, I will be going to the pub myself.
British Prime Minister Boris Johnson isn't alone in wanting to celebrate a major step in reopening. When pubs and other non-essential shops in England let people back in for the first time since December, it will be business as usual. No need for a vaccine passport.
On COVID status certification, as we prefer to call it, I think the most important thing to say, there is absolutely no question of people being asked to produce certification or COVID status report when they go to the shops or to the pub garden.
A document proving a person has been vaccinated or has COVID-19 antibodies led to a chorus of opposition. The government says it may be needed in the future to allow people to safely attend events or to travel, but nothing has been finalized. People are being encouraged to take regular tests. The National Health Service is providing free lateral flow kits, which can provide results in about 30 minutes. The UK's chief scientific advisor acknowledges they're not 100%.
A negative doesn't mean you absolutely haven't got it, but a positive that is useful to identify those people who then need to isolate.
It feels really nice just to be able to get out and breathe fresh air.
The joy of being reunited with friends and family is not lost on the Prime Minister. It was a year ago that Johnson himself was fighting for his life in hospital with COVID-19. Another reason for him to celebrate with that pint. Crystal Goomansingh, Global News, London.
In France, clandestine restaurants operating in violation of pandemic restrictions have triggered a police investigation and possible charges.
Le soir, c'est les menus à partir de 160 €.
A hidden camera shows a journalist posing as a guest to access one of the mansions in Paris hosting a pop-up restaurant. Menus start at more than €160 per person and include champagne, truffles, foie gras, and lobster. The footage reveals guests weren't wearing masks and weren't physically distancing. There are claims government ministers have been dining at these secret restaurants. This will surely irk the legitimate restaurants that have been closed since October to help slow the spread of the virus. The country has the 4th highest number of cases in the world. First, he fired Derek Chauvin, then he testified against him. Coming up, the police chief's damning testimony in Minneapolis. Plus, the state of emergency in Florida over a toxic reservoir and a major donation from a major music star.
You're watching Global National.
More than 100 people are dead in Indonesia and East Timor. Torrential rains from a tropical cyclone caused devastating flash floods and landslides. Dozens are still missing in the two countries. Authorities fear the death toll will climb once waters recede and recovery crews dig through the mud and debris. And in Florida, an environmental emergency is unfolding. A reservoir holding back 1 billion liters of wastewater is on the brink of collapse. Multiple leaks have been spotted and a retaining wall has shifted. Hundreds of people have been told to leave their homes, and crews are working around the clock to pump out the water. The reservoir holds a mix of salt water, fresh water, wastewater, and fertilizer runoff. There was more damaging testimony today in the murder trial of former Minneapolis police officer Derek Chauvin. The doctor who tried to revive George Floyd testified a lack of oxygen likely caused his death. But it was the words of the city's police chief that may be critical to the prosecutor's case. Jackson Prosco reports.
The testimony about to give will be the truth and nothing but the truth. Thank you, sir.
In a stinging rebuke, the chief of the Minneapolis police broke ranks and testified against one of his own.
Sanctity of life is absolutely vital, that is the pillar for our use of force.
It was Chief Medaria Arredondo who previously fired Derek Chauvin and 3 other officers after George Floyd's death, calling it murder. Monday, the chief testified Chauvin's use of force, a knee on the neck for 9 minutes and 29 seconds, went directly against department training.
Once Mr. Floyd had stopped resisting, and certainly once he was in distress and trying to verbalize that should have stopped.
Over the past week, the jury has heard from other police officers.
What is your view of that use of force during that time period?
Totally unnecessary.
Who testified that Chauvin used excessive force.
If your knee is on a person's neck, that can kill him.
Monday, the court also heard from the doctor who spent 30 minutes trying to resuscitate Floyd in hospital.
We were trying to resuscitate Mr. Floyd.
Dr. Bradford Langenfeld testified that a lack of oxygen, asphyxia, likely caused Floyd's death, saying he had no reason to suspect a drug overdose, a theory Chauvin's defense has raised. Chauvin and the other officers did not render first aid after Floyd stopped breathing.
The defendant violated our policy in terms of rendering aid.
Dr. Langenfeld told the court that by the time responding paramedics began CPR, it may have been too late.
Approximately 10 to 15% decrease in survival for every minute that CPR is not administered.
In the coming days, more officers are expected to testify, along with experts in policing and medicine. The defense will argue Floyd's death was caused by drugs or an underlying medical condition. The prosecution will continue to hammer away at the use of force. Jackson Prosco, Global News, Washington.
Still ahead, will Ottawa's next budget help women left behind in the pandemic? The Weekend is donating $1 million to support relief efforts in Ethiopia's war-ravaged Tigray region. The musician, whose real name is Abel Tesfaye, is the son of Ethiopian immigrants. In a statement, he says, "My heart breaks for my people of Ethiopia, as innocent civilians ranging from small children to the elderly are being senselessly murdered, and entire villages are being displaced out of fear and destruction." His donation will support the World Food Program. The agency says it will provide approximately 2 million meals. Humanitarian access to Tigray has been severely restricted throughout the 5-month-old conflict. The impact of the pandemic on the economy is unlike anything we've seen before, and it has disproportionately affected women. That's why economists and labor experts want the upcoming federal budget to have support programs for female workers. They're calling it a she-covery effort. Our senior business correspondent, Anne Gaviola, explains.
In past recessions, men's employment took a bigger hit and women's job gains led the recovery. But not this time. When employment fell off a cliff at the onset of the pandemic, industries dominated by women, service, travel, tourism, events, bled jobs, and many haven't come back. Economist Armin Yalnizyan coined the term she-cession.
I think it is impossible to have a recovery without a she-covery.
She says a different kind of downturn requires a different kind of solution, one that focuses on the so-called caring economy, the often unpaid hours of work, the majority done by women, to take care of children, the elderly, and those unable to look after themselves. Rolling school and daycare shutdowns have erased decades of employment gains for women workers.
Early learning and childcare has to be the centerpiece of the next budget, from the first ever female finance minister of Canada in the first ever self-declared feminist government of Canada.
The Liberals have promised to create a national childcare system needed to help parents, mostly women, stay or get back into the workforce. Labor market analysts say tools to allow workers to reskill will also help. And human resource experts are calling on Ottawa to create incentives to help employers retain women.
Any types of through EAPs, through different types of programs, through wellness programs within the workplace. If employers can be provided with the financial means to provide these supports within the workplace, that would really go a long way.
Men have returned to the labor force more quickly, but nearly 500,000 women remain unemployed. 100,000 have dropped out of the workforce. Historically, the longer they stay out, the more likely they are to stay out permanently. Reducing household income and spending, productivity, and tax revenue, all a major drag on any hope of a sustainable recovery. Anne Gaviola, Global News, Toronto.
Tomorrow marks the 3rd anniversary of the Humboldt Broncos bus crash, and tonight the team's hometown has unveiled its vision to honor the memory of the 16 people killed. There will be a roadside memorial and a tribute center to showcase the spirit of the nation in the wake of the crash. The city of Humboldt will launch a national campaign to support the cost of construction. In 2018, the Broncos team was on its way to a game when it crashed into a truck that had run a stop sign. The Canucks versus the coronavirus. Up next, COVID-19 checks Vancouver's hockey team. The Vancouver Canucks are at the center of a COVID-19 outbreak. 17 players are on the NHL's protocol list. That's more than half the team. Some coaches have been hit hard too. The NHL insists the season isn't over for the team, but as Eric Sorensen reports, the cases are still throwing a wrench into the schedule.
For a while, the all-Canadian division of the NHL looked to be getting everything right. The season was proceeding almost uninterrupted. But now the Vancouver Canucks have been brought to their knees by COVID-19. From netminder Braden Holtby to star forward and captain Bo Horvat, close to 20 Canucks players and coaches are on the league's protocol list. Some are thought to be quite sick. Adam Gaudette's wife is herself recovering and tweeted last week, "My hubby isn't in great shape, but I'm taking good care of him." First and foremost, there is concern for the health of the Canucks and their families across the league.
Obviously, what's happened in Vancouver is a lot more than hockey. So, we're obviously thinking, we're hoping that everyone's doing all right.
There are reports the more infectious variant first seen in Brazil is involved, potentially raising new risks for the league.
We're now learning this may make behaviors that were previously accepted and safe a little bit less safe.
The NHL says it remains confident the Canucks will be able to complete their season. The league began January 13th with a 56-game regular season to run till May 8th. Then the playoffs were to start. Up to March 20th, more than 24 U.S.-based games were postponed by COVID, with other games rescheduled. But then Canada was hit. Starting March 22nd, 4 Montreal Canadiens games were called off, and now for the Vancouver Canucks, 4 games have been postponed so far, and there may be more. The NHL is now extending the regular season to make up games starting the week of May 10th, and the playoffs will be pushed back from there. There is speculation the league may have to return to a bubble like last summer.
It's really incumbent upon the Canucks organization and the league to really ensure that the situation is tightened so that it doesn't spread and become a much bigger problem.
But what has happened to the Canucks is a cautionary tale for all of us.
If that can affect someone of that physical caliber, none of us are at this athletic level. All of us are at risk.
The serious outbreak with the Canucks comes in spite of the league doing regular testing and following stringent protocols, a sign that the next phase of the pandemic may be riskier than first imagined. Eric Sorensen, Global News, Toronto.
And that is Global National for this Monday night. I'm Robin Gill. The signs of spring are cropping up in many parts of the country and especially in British Columbia. So we'll leave you tonight with a sunset flyby of these beautiful cherry blossoms. They're a staple of the Vancouver landscape at this time of year. Thank you for watching. Donna Friesen will be back at the anchor desk tomorrow, and I'll see you on Friday. Have a great night.